All right, everybody, we're going to get started. I'd like to call this meeting to order, the time being 9 o'clock, 9 a.m. on Wednesday, February 17th. I'd like to call this meeting to order of the Public Health Committee of Kane County. I am Committee Chair Jared Sanchez. Clerk, could you please call the roll?
Silva.
Thought I heard.
Lewis.
Lewis here.
Shepro.
Shepro present.
Strathman.
Strathman here.
Deppie.
Deppie here.
Weber.
Present.
Sanchez.
Okay, if I could have a motion and a second to approve the minutes of January
Move to
22nd,
approve.
21st. Mr. Shepro moves.
Strathman second.
Strathman seconds. Any changes, corrections, deletions? Hearing and seeing none. Clerk, could you please call the roll?
Lewis.
Lewis, yes.
Shepro.
Yes.
Strathman.
Strathman, yes.
Deppie.
Yes.
Weber.
Yes.
Silva.
Silva, yes.
Okay, minutes are approved. Finance and budget. I know we have Cannell here. I believe Cannell is here with us today. He's not? Okay. Is there anyone that has any questions about the budget for this month with the health department? Okay, we'll move on. Public comments on agenda items. I'm not aware of anyone that has signed up for public comment. So we will move on from that. Animal control.
Good morning, everyone. How are you doing today?
Good, Brett. How you doing?
Very good. We don't have much to report this month. Revenue is over expenses, which is our goal every single month. So if anybody has questions, of course, always let me know. We are in the middle of our floor project right now. Our back half of the kennel has already been finished, our floors. We're very excited about that. And they're working on the front half of the building right now. So we're a little torn up, but we're very excited to get the floors complete. It's going to be better for the animals, safer for the people, and just we're real excited for the aesthetic of itself. So we're halfway through the project, doing really good, and we hope to show it off as soon as it's done. Other than that, I don't have much, but if anybody has questions for me, I'm always available, please.
Excellent. Thank you, Brett. Does anyone have any questions or comments for animal control? Okay, we'll move on. Thanks for being here, Brett.
Thank you. Thank you.
Move on to the executive director section, the update for COVID-19. And just so everyone that's online knows, county board side, I have Zoom open. So if you do put a question into the chat, I will see it and address you. Otherwise, call out appropriately and when the conversation starts and go from there. So I think today, Michael Isaacson is going to give us the COVID-19 update. Correct, Michael?
That's correct. I'll defer if Interim Director Foster wants to lead with any comments.
Thanks. Just one thing I want to give a formal thank you to all our partners. We had a very successful last week with the coordination for the school districts, for all the educators and the support staff. It was a huge effort, and it was a great planning process with the school districts. And when everything comes together, everything works out really well, which it has. So we're very excited that we were able to, throughout the county, orchestrate having the vaccines given to the educators and the support staff of that, because it was very important that all the school districts felt that they were getting it at the same time, and there wasn't another school district that felt, oh, well, this one got it before the other. So we were very pleased with that. So, so thanks all for that. I just wanted to formally thank. So, all right, Michael, take it away.
Okay, very good. Thank you. So thank you, everyone. I've tried to keep the presentation pretty brief today so we could leave more time for conversation and questions. So in working with Chair Sanchez, I think we're going to hit on some key things that people are interested in. So first, we wanted to talk about where vaccine is going that's coming into Kane County. So on this slide, you can see the distribution thus far for all of the doses that have been received by the Kane County Health Department. I do want to point out, and you've probably heard us talk about before, we are able to direct ship to some of our partners now. That process is not completely transparent in the sense that once we put in a request, I'll just use the top of the list here. If we put in a request to direct ship vaccine to Northwestern Delnor Hospital, once we put in that request, we no longer can track it. So we need to follow up with Northwestern, see if that request was actually approved, see if that delivery was actually made. Excuse me. And it's not completely straightforward with many of our partners because especially with the hospital systems and our federally qualified healthcare centers, they're all working with multiple counties. So as they're getting shipments in, it's a little harder for them to track. So just so people are aware, for those direct shipments, it's a little harder to have the exact numbers at any given time. We know what we request, and we're working on improving a system to validate what shows up. But this shows that over the past 2 months, we've distributed just 33,000, just under 34,000 doses of vaccine to our community partners. And you can see who they are. There are 5 hospitals, our federally qualified healthcare centers, Aunt Martha's, Greater Elgin Family Care Center, and VNA Healthcare. We've started shipping to the pharmacies, which is Meijer, an organization called Prism Health Lab. This is something that we did in partnership with the state so that we could set up a special event in Carpentersville, which I believe Chair Sanchez spoke of at a previous county board meeting. And then private family practices. We've opted not to list here because we don't want them to be inundated with phone calls. It's only 300 doses that we've distributed so far. But when we get more vaccine, we have more physicians on our list that we're going to be able to provide for. Chair Sanchez also asked if we just spend a moment kind of talking about the process that we go through each week to determine where our doses go. So every Monday, the health department sends a survey to all of the providers that have been approved. And again, just as a refresher, to be an approved provider that can receive vaccine, they have to be part of the statewide vaccine registry, which is called iCare, and they have to be approved by the state and the CDC to be a COVID provider. So if they meet those 2 requirements, we sign an MOU with them to direct how the doses are going to be used. And then we put out a survey and we ask them a series of questions. We ask them how many doses they provided the previous week, how many doses they anticipate needing the next week, how many doses they have on hand, because if they have doses on hand, we do not want to give them extra doses because we don't want any vaccine sitting around. We want it to get into people's arms as quickly as possible. We ask all of those questions twice, once for Moderna vaccine, once for the Pfizer vaccine. Once we get all the surveys back, we compile that information, and then every Wednesday, we are scheduled to hear from the state what our allocation is going to be for the following week. So we take the requests from our community partners. We also know what we've committed to or what we plan to do as the Kane County Health Department, and then we compare it to what numbers are actually coming in. For the current week, we are getting less than 1,500 new first doses from the state. So we're getting 500 Moderna and 975 Pfizer that can be used to vaccinate people with their first dose. So the requests that are coming in are typically requests in the thousands, so that we're only getting 1,500, I think just frames this supply issue that we have right now, that we need much more vaccine and that we have much more capacity in our community. We take that information that we get from the survey, we take the information that the state gives us in terms of what they're saying we can get, and we discuss it as a team, Kathy and Uche and others at the health department, and then we put in our formal request to the state where we're asking them what can be provided. And then we ask for additional vaccine as well, which typically those additional requests are not met, but we still put those requests in just so we can document that. Moving to the next slide. Here's a little bit about what's been happening with vaccine in Kane County. And I'll show the actual website live in a moment here. So here's the link to the page where you can track vaccines across the state. I think this is excellent for transparency. I think this really helps to show how everybody is doing. There is some nuance in how the numbers are reported out. So we want to make sure that we're available to answer questions if people do have questions. But you can see the blue bars on this chart on the left represent how many vaccines have been given out on a daily basis. And this orange line is our 7-day rolling average for the number of shots that have been provided. So as of yesterday, we were averaging about 2,700 shots per day. Just with rough math, what I'm looking at is 70% of our adult population would be about 280,000 residents. If we provided everybody 2 doses of vaccine, again, we do have a new Johnson & Johnson vaccine, which is a 1-dose vaccine, which we hope gets emergency use authorization here very soon. But right now, just for conservative planning, if we hope to give everybody 2 shots, that's 560,000 shots that need to be provided. So you can see we've given about 60,000 in our community so far. If you are trying to balance the supply, our inventory with the shots provided, it's never going to match up. There's multiple reasons for this. One, we have seniors and we have staff from long-term care facilities who are being vaccinated as part of the federal pharmacy partnership program that we've talked about with CVS and Walgreens, where they're actually going on site. So those numbers will show up here, but we never see the supply. So that's not going to match our inventory. A second reason is that now the state is starting to direct ship to more pharmacies. So we knew this was going to be happening. This was always part of our plan. But numbers, for example, that go to CVS Pharmacy, where I know they're vaccinating about 2,000 seniors in Elgin over the last couple of days and into next week. Those doses don't show up in our inventory, but they will show up in terms of our residents who've been vaccinated. And then a third reason is people get vaccinated in different places. So if somebody goes over to DuPage County because they're a patient of DuPage Medical Group, they're not going to quote unquote use one of our vaccines, but we're still going to get credit for that as one of our residents being vaccinated. And that works, as we've talked about, both ways. When DuPage residents come over to, say, Rush Copley Hospital because that's their medical home and get vaccinated, it may be one of our doses that's used, but it counts towards the other county. Over on the right-hand side, you can see the age demographics. So you can see about 1/3 of our shots have gone to seniors so far, and then about 2/3 have gone to people age 16 to 64. Part of this, I expect these numbers to shift. It's based on our 1A and 1B categories. So just a reminder that in that 1A category, that was really looking at healthcare providers, where people tend to be younger who are still active in the workforce just on average. So these numbers are leaning a little bit younger, but I expect that that's going to change as we move forward. But we do know from looking at the data that about 1/4 of our seniors have had their first shot. So we're making progress. Again, it's slow. Only getting 1,500 doses this week is not helping us to really accelerate what we're doing, but we're moving the right direction. And from my perspective, even though, again, it doesn't help with making it clear in a one-stop shop, if more doses are coming into our local pharmacies and are available to our residents, I think that's a good thing. And then finally, we always like to remind people, we do have several months of this, so we want people to wear their masks and to practice social distancing. Even though the numbers are looking good, we're seeing less hospitalizations, we're seeing fewer deaths, we still need to be diligent. And Chairman Sanchez did ask me to just show a live shot of the website, just so you can see it for yourselves. So this again, and I put the link in the PowerPoint, which I'll send to be circulated. But this, if you click on the IDPH website, this is under vaccine data. I put the direct link in the presentation so you can see it. You can see for the whole state, the vaccination numbers. So we've administered 1.86 million doses. Total doses that have come to Illinois are 2.4. This is in reference to the long-term care facility project. And then in Illinois, we're averaging about 63,000 shots a day. But if you come down here, you can see the state numbers, but you can also look at this by county. So the county numbers are what I just showed, was on the slide. We were going to look at, just for comparison, as Chair Sanchez and I were looking at this yesterday, There's other communities like Champaign County, and I think they're doing a great job, and I think everybody in the Chicago region is doing a great job. But they've administered 53,000, almost 54,000 doses, but their population is less than half of ours. So they have administered quite a few doses, almost as many doses as us, but they have half the population. Well, the problem is they're getting way more doses than we are. So we need to figure out with the state rubric, and we've been talking to the state, and I know other health departments in the Chicagoland region have been having these conversations where many counties are getting much more vaccine than we seem to be getting. There's talk about vaccines sitting on shelves. We don't actually see that. And I know from talking to the other health departments in the Chicago region, they don't see that either. So we're trying to figure out how this allocation process is working and what we can do to get more doses. And again, this is excellent for Champaign County. That's a very fine health department. We know and work with those people, but we want more doses here for Kane County. As I scroll down, you can see the 7-dose averages. Actually, let me go back to Kane County. So,
Michael, just real quick,
Yeah,
I'll
please.
open it up to questions afterwards. Just let Michael get through the presentation and then we can ask him some questions.
very good. Yeah, and I'll be done in one moment here. So you can see our average 7 days is about 2,700. They're reporting that we have 16,000 doses in inventory, saying that we have 8,000 doses on hand at the health department. And this can be one of those pieces that's deceptive because we don't want to be perceived as sitting on vaccine. But for example, when we get a shipment of vaccine that's going to be used for second doses, which is separate from that 1,500 that I mentioned, those doses are already spoken for. So we have clinics going tomorrow and Friday where we're administering second doses to people who 28 days ago received their first dose from us. When we get those, we have to hold them until our clinic. So when the public looks at this or when any officials look at this, we just want to make people aware that sometimes it's a little deceptive when they say we have an inventory. We're not sitting on it. We have a plan for that that's going to be used within the week. And then I did just want to point out in terms of health equity, and again, part of this is based on who has been in the 1A category, but you can see almost 70% of our shots have been provided to the white population, and only 10% have gone to the Latinx community, even though Kane County has the highest percentage of Latinos in the state, with over 30% Latinos. Only 10% of people have had the shot. So we're very mindful and are working with a lot of people to get more shots into workplaces where there may be more diverse populations working there. Also, as I go over to the African-American community, only 2.7% of the shots have gone to our Black population, even though 3 times that many people are made up of our overall population here in Kane County. So we are seeing disparities. This does reflect what's going on around the country and around Illinois, but it is something that we're mindful of because based on the type of work a lot of people do, again, as a general statement, we want to make sure that we're protecting people. And then finally, and you can see, more women than men right now, but again, that may be job roles and things like that. This chart is another one that may cause some consternation from constituents when they look at it, because this is reflecting purportedly the percentage of each age group that's had at least a dose administered. So the Peoria, and this is actually where Chair Sanchez and I were looking to see Champaign, they're claiming that, or not claiming, I shouldn't say it that way. The state is reporting that 69% or 68.4% of their seniors have had their first dose. Again, if we had more doses here, we could do that too. But if you go to the bottom of this, and I believe in transparency and I believe in putting this information out, but you see Kane County down here, you see McHenry County and Will County below us. You see Kankakee, DeKalb, Lake, the Chicago area health departments or communities are down at the bottom of this list. There's Chicago, there's Winnebago, there's Cook, there's Grundy. So we need more vaccine in this area. It's not a reflection of how vaccine's being pushed out, but I think when constituents look at this and they're going to say, why are we at the bottom? The whole Chicagoland area is at the bottom of this list. I think it's good to present this data, but I think there is an important caveat. And then the final thing I'll say is this is another number that people are looking at a lot, where you can see the percentage of the population that's fully vaccinated. So they've had 2 shots. And in Kane County, as of yesterday, 2.43% of our population was fully vaccinated. So just looking at our neighbors, it's a little bit lower than the 2.98% in Kendall County. It's a little bit higher than the 2.36% in Lake County. Again, we're at the start of this, so these small numbers are going to even out, is my guess, as time goes on. But I think that's an imperfect measure. It's based on the full population. So this includes a baby that was born a week ago that's not even eligible to get a vaccine. But it's a good number that we can track. So it's not perfect, but certainly the public is looking at it, and it's something that we need to be aware of. And again, this is where you can see the inventory, where Lake County's got 19,000. They're reporting that we have 8,000. Kendall County has 2,400. So those numbers may reflect a lot, and I can't speak to the other counties, but for us, reflect a lot of second dose shots that we have on hand. So we just wanted to provide a little bit of information that hopefully will match the types of questions people are getting.
Mr. Tippy, you had a question or comment?
Vern Tepe here. Michael, on the pie chart where you showed some 19,467 seniors had gotten their shots, when you had that up there, you said that, I believe it was Meyer had gotten 2,000 doses directly.
Correct.
Would those 2,000?
CVS, yes, sir.
CVS, okay, sorry about that. Would those 2,000 be included in the 19,467?
Once they are logged into the statewide registry. So I don't know the timing for CVS, if they do that within 24 hours, 36 hours. We're supposed to do it within 24 hours, but the data, at least on this website, it says there can be a 72-hour lag. So I don't know for sure of those 2,000 doses. And a couple of the 2,000 I referenced are coming up in the future in clinics that are going to happen this week.
So any discrepancy in the number would be the numbers that you give for the county for doses that you've distributed, and then doses that maybe have been recorded, that would be because they got something directly from the state or from some other source, perhaps. Yes. Okay.
Oh,
Right with
yes,
that?
or people going back and forth over county lines. Yes, sir.
Yeah. Thanks.
Mr. Shepro, you had a question?
Yeah, a couple. The more I hear, the more actually a little confused I get about all of this. So I'm going to try to make these coherent. Michael, I guess my first question is sort of following along with what Mr. Tepe had questioned. For people like CVS and so forth, are they therefore getting separate allocations for whatever county they're in from the county, or are they getting it directly from the state?
In this
Or are they
case,
getting it from somewhere else?
it's coming directly from the state, or there's the potential for CVS and Walgreens. Some of it may be part of that federal program where they've reallocated some of the long-term care facility doses.
So is there, I get the part that our rate is lower because we're not getting the shipments, but I guess the real question then is, why are we getting, I don't want to say a disproportionate share, but I know that a lot of the shipments apparently are based upon the particular population category 1A, 1B, but I'm wondering why we and the other large collars are so low. On your one map, I saw that Adams County was really dark blue and everything else was, could you maybe elaborate on that?
I can elaborate a little bit about the conversations we've had, but I do not have a satisfactory answer to the question. We as local health departments talk to the state every week. We have multiple meetings with them. And for the Chicagoland region, that is a common theme that's been put forward in terms of how those allocations are made and what the actual rubric is. We do not have a clear understanding of how that works across the Chicagoland region. But I defer to, I don't know if Director Foster, if you have any insight from conversations you've had with other health departments.
No,
Who's
just,
in charge? Oh, I'm sorry, go ahead.
no, that has not come up as far as the numbers, the proportion. It's just like, what you had mentioned with the 1A and 1B. So, but no, that has not been discussed. I mean, most of the discussions have been around low vaccine supply, period. So,
Lots
For-
of questions I get from people are, who is the decider? You know, who is deciding that we get this and Adams County gets something else? Is that the governor's office? Is it the IDPH? Is it, somebody in Washington? There seems to be a lot of, why could I get it if I went to Rock Island and I can't get an appointment here type of thing.
so yeah, so it comes in from the federal government through to IDPH, and then, as I understand it, IDPH does the allotments each week.
But they haven't, or maybe I should ask it this way. Do they have any published guidelines as to how they decide where it goes to, around the state? Again, it just seems
Not
somewhat
to my knowledge,
random when you try to understand it.
right? Not to my knowledge, and that has been asked in the meetings. So,
But
There
you
was a-
haven't gotten any answers that you're satisfied with.
no,
They haven't
Yeah, we-
provided the transparency that we want.
Yeah.
Essentially.
Exactly.
Chairman Parag?
I may, can you hear me?
Mhm.
I may have a little background on that information. When the
We can't hear you. Sorry.
There we go. That's better.
Yeah,
Uh,
thanks.
When, in January, when the vaccines are first being distributed, it had been said by the governor's office, in my memory, that because of the economic disparity that was occurring downstate, there's high level of poverty, as we all aware of this, high level of poverty, that the vaccine was going to be distributed focusing on those efforts. It's a smaller population. And as now I hope that will now, the parity will start moving forward to the collar counties. Cook County is separate, so we have to factor them out of our equations and comparisons because they're getting their vaccines directly from the federal government. Chicago is, it's the state of Chicago. So it is different, so we can't compare ourselves to them. But the collar counties hopefully are going to be getting more of the vaccines now.
Dr. Silva, did you still have a question?
Yes, thank you, Chairperson Sanchez. So this sounds to me like something that needs to be addressed also with our legislative committee, because these are the types of endeavors that we can handle there. I found that I'm probably better at doing some research and getting some answers in the county than other people are because of my public service position. So I feel that we can also start to bring in our respective legislators. Are we talking to our senators and our state representatives? Because I think that they are in a keen position to, if not solve these issues, obviously to find some answers. And I think that that goes a long way. Thank you.
Thank you, Dr. Silva. And I know we have been in contact with some of our Kane County legislators on this issue, and speaking with Legislative Co-Chair Gums the other day, we are going to be teaming up a little more closely in that effort to really just make sure Kane County is on the map as far as the attention that the legislators have. They have a lot of people coming to them for many different things. We need to make sure that we are getting the due priority. Mr. Shepro?
Yeah, I guess the trouble with the theory that you're doing it downstate because it's depressed, when you look at the map, for example, Alexander County appears to be almost at the bottom, and they are arguably one of the two poorest counties in the state. And I guess the other statistic that strikes me is that many of those counties are kind of uniformly economically distressed, whereas in Kane County, with the comment about the 30% Hispanic population, it doesn't seem to me right that we don't get enough vaccine for them because there are a lot of rich people in, Campton Hills or someplace like that. And, I know there's been lots of talk about regions and areas and subgroups, but it does seem to me that Lake County scores very high, and that yet you've got North Chicago, Waukegan areas where quite clearly, as Mr. Isaacson said, certain demographic groups seem to be dramatically underserved. And I don't know whether, one would hope that is not deliberate. It's one of those accidental things that are the result of a policy. But I agree with Mr. Chairman with your comments. I think we need to ratchet up the pressure for those communities which are clearly dramatically underserved. And I hear anecdotally so many people that said, well, I was able to get Rock Island, or I could go to some other county. And I guess one more question from Mr. Isaacson is each county or supplier basically able to set its own policy as to whether they will give the vaccine to residents, people who work there, or just people who get in their car and drive for a long ways from another county? Is there any rhyme or reason to that, or is that ad hoc by county?
Yeah, the way the state communicates it to us is because the allocations are made based on who lives in your community. We're sensitive to that at the local level, where we try to focus on people who work or live or get their medical care here. But as we've discussed before, the state makes it clear that this is a statewide effort. And I think from the federal perspective, it's a federal effort. So it would not serve us well if we had busloads of people coming in and soaking up our vaccine from out of county or out of state. But at the same time, I think that the perception is, or the guidance is, that people are able to set their own rules locally to a certain extent. That's at least how it's been communicated to us, is that, you'll see if people go on the statewide site where they can make appointments, it's pretty common to see that it is only eligible for residents of that community.
Chairman, I was thinking about the registration and the challenges that many of our families and seniors have in doing this. I would like to ask you working with our legislative committee to discuss why we have not developed, either as a state or potentially maybe we could be a leader in this in the county, to develop an algorithm so that you log on, you give your appropriate information, and it goes through all the variety of different opportunities where you can get a vaccine. It presents you with that data. You choose that date, you register for it, and you're done. It is highly complex, even for the best of us who are computer savvy and have that literacy. Stores do it. If I want to order a blouse from a women's clothing store and it's not available at my local store, they'll run the algorithm and they'll ship it to me from across the country. Why can't we do that here for getting shots, getting a life-saving vaccine, and make it easy for us? So I'd like to put that suggestion out there, and let's see if we can work on it.
Thank you, Madam Chair. I think that's a great idea, and it's certainly a good moment for any app developers that are out there that may be listening, entrepreneurial app developers, because that would be a huge, that person would be $1 million.
Mike, please. Mike, please.
What's that?
I can't hear you.
Can you hear me now? Is that better?
Not
No,
much.
Mr. Chair Gums.
You're on mute, Chair.
Mr. Chair, Gums.
Is that better? How's that?
Just a little muffled.
I have the mask on, but I think that microphone.
Yeah, that's
is-
better.
No, that's, you fixed it. Thank you.
Mr. Sheppy.
Mr. Chair, as you know, with discussions that you and I have had, a big part of my concern are primarily seniors, but also others that really just don't have computers, don't have computer skills. Because I know people that spend hours each day trying to get an appointment, and that number is beginning to dwindle because those people have been successful. So I know that Mr. Isaacson has a committee that's working on it, and I've also talked to him about it.
Mhm.
So there are organizations like Senior Services or AID here in Kane County. I also know that AARP is very interested in this, but we need to help those people that just are not computer literate wend their way around making this happen. And I continue to dedicate myself to trying to make that happen.
Thank you, Mr. Cheppy. Yes, and a local library district by me has contacted me, and I'm going to be talking to them about what can they do to help with that effort, people that need help to find an appointment and a vaccine. So anything that we can do to assist people in this is well needed.
And Chair Sanchez, if you'd like to send any of those libraries or townships, we've reached out to all of them, and as Mr. Tepe mentioned, we did have over 70 people participate in a conversation a week ago. We've done a survey where we've collected information from all of the providers for exactly how they'd like their information listed. I just opened the survey up for one more day. So at 5 o'clock today, I'll close that survey, and we will have a list that we can print that we can give to seniors. But thus far, we've been having very good luck with Senior Service Association and with Age Guide in working with the senior population. And another thing that we want to commit to at the health department is when we're hosting clinics, we want to carve out a certain number of slots that we can pull people from those lists from senior services and the libraries and the townships, the people that we know are not big lovers of computers, and make sure that we're giving them the access so that they can get registered for our clinics. So I think that's an area. And then as we move forward in terms of health equity and things like this, I think we're going to need to do this for other populations. But as we've discussed several times here at this committee and at the full county board meeting, we're very aware of the trouble with this being so technologically focused. And I think we have some pretty good fixes in place for that.
Yeah, and we get phone calls here at the county board office, people asking for a phone number to call to get an appointment. So it's definitely a need out there. Madam Chair.
Thank you again. I've gotten letters from several library districts, and I'm curious to know if we're able to move our librarians up to 1B. Currently, they're not considered on that list. Other counties have done that. And what is the process? So if we're going to be using our libraries as resources for our seniors and other individuals to come in or call, they're going to be working with a diverse population. They have no ability right now to get the shot unless they're considered 1B because of age or another opportunity. So what does it take for us to make sure that all of our library staff is able to move to 1B, because that is under local control? And if we're going to be using them, let's supply them with the means that they can stay safe and well to be able to serve our public.
So I can answer that. So whenever I get questions from people about what group do I fall in or why can't I fall in this group, we have a direct line to IDPH to clarify like any type of answers for that. And the answer that we received from IDPH several weeks ago was it was for librarians that were in the school districts. It was not for public libraries, and they were clear about that. I mean, unless IDPH changes their, their views on it, or they're going to, put them in 1B. That's really the only way. I mean, we would just have to go against what IDPH, says. And I don't know if that's, the road we want to go down, but that's, that's what we've been doing. That's what we did for the judicial and the judges. I sent in a request on that, and then they gave us what the guidelines was for that, and we were able to open it up for, the criteria that was met. And, we'll continue to do so. We just want to make sure we stay in the guidelines of IDPH. They're the ones providing the vaccine. And so that's this is what we've been following.
Yeah, I think it's worth maybe checking in with them again on the issue and see if there's any wiggle room, because just maybe I'm biased, but I think libraries should be open so that people can use the resources that are available there. It's very important to communities. And so, yeah, I think it's worth revisiting. Mr. Shepro?
Well, one, I think they're at least as important as gambling casinos. So, but I guess the last couple of days, I've seen a lot of news stories about people organizing volunteers to go help shovel driveways for seniors. I saw there was a piece about Alderman Cardenas in Chicago organizing some of his community. It occurs to me that we've got an awful lot of young people who are really computer literate, and I don't know who would organize it, but it seemed like that would be a great resource if you had a go-to group of volunteers who can go on the internet and search, because I knew, we all know lots of seniors who don't have any idea how to use a computer, or at least how to use it to go through what is a painful process that was alluded to earlier. I mean, my wife probably spent 20 hours in a 3-day period trying to find, and I'm sure other people have similar experiences.
And I think, Mr. Shepro, that's exactly what we're about to roll out. So right now we have the common partners like Senior Services and Age Guide, but we also just, for example, there's a group, Batavia RSVP, which is made up of volunteers who said they'd be willing to do exactly what you're describing. So we just want to make sure that we put originally we wanted to put out one number to make it easy for people. But because of the variety of groups that are going to be engaged, what we decided is that we would have a list of numbers and that a person would be able to look and see where they live, or if they already have a relationship with an organization, they could call someone they're familiar with. We do want to make sure that people are calling a trusted place because we are wary of scams that are occurring, that we don't want seniors to be talking to somebody who may be taking their information or taking advantage of them. But I think exactly what you're describing, we should have in the next day or two.
Sure.
Mr. Chairman, Bates here.
Hold on, Bates. Mr. Brown had his hand up first.
Thank you, Mr. Chair. I just have a question. As the state opens up another category of people that are eligible for the vaccine, but the category prior to that has not yet been completely fulfilled, are we required as the county to allow that next category to start getting their vaccines, or do we not go along with that next category until the prior categories have all been fulfilled?
Well, as we're seeing in Cook County, who's in Chicago, who's rejected expanding that 1B category, there does seem to be, again, what we've said here, some local controls and determinations. And we were just talking about this yesterday. We're investigating, the pros and cons of doing it or not doing it, and coming to a determination. So, and that's something we were going to bring up a little later, but yeah, Mike, if you want to address that right now.
Yeah, because I have had some questions, somebody that's 78 years old says, I still can't get my vaccine, but now you're going to let somebody that 60 or 60 years old get it? What, there's something wrong with
Or
that?
25 and with
Yeah.
diabetes.
Yeah.
I mean, it's kind of a catch-22 with anything we do. If we create an event for this population, this subcategory, this other subcategory is going to be upset that
Right.
it wasn't them. Everyone wants to be at the top of the line. Mr. Isaacson, did you have anything you wanted to add to that?
I mean, I'm happy to share input into the decision-making process. I think ultimately it's going to be a policy decision for Kane County, exactly how we want to address it. Chair Sanchez, as you pointed out, it is a slippery thing that cuts both ways, because certainly there are plenty of residents that we've spoken with who have serious health conditions that I feel bad that they've not been able to get a shot. And it's also true that you make the number of people who are eligible larger, then you're going to inevitably make it take longer to reach everyone on the list. But we can look at the data, and with Director Foster and Chair Pirog, we can talk about what the Kane County process would be.
Ms. Bates, you had a question?
Yes, thanks.
I'll come to you.
So I'm getting questions about why is Kane County administering doses, or are we not? Do we administer doses at Kane County Health Department, or where? How does that work? And what can I tell my constituents that, so we are administering where and when?
Sure. So we've been doing what we call closed points of distribution. So we started with the healthcare professionals, and we've been using the Kane County Fairgrounds as one of our sites. We do have agreements with locations all over the county. So when vaccine becomes available, we can work not only with shots that the health department's administering, but also helping to coordinate with other pharmacies so they can go into large churches and community centers. So right now, for example, tomorrow and Friday, the health department is going to be administering several thousand doses of vaccine. These are second dose vaccines that we're really focused on for this clinic. We may be able to squeeze a few extra people in that we've been looking at some of these 1B categories to get them invited, but it's not open for the public for everybody to sign up at this point. I think when we move into future weeks, we still are going to have second dose clinics where every time we administer, if we have a day where we give 2,000 shots, 28 days later, we have to have all the resources in place to provide those same people the shots again. But we are going to be making more opportunities available for community clinics. That's something we are hearing that is a request. I will say, though, that part of it is a perception, and we need to be able to meet the public's expectations. But I think when people look at other communities and see on the news that somebody may have something going at the fairgrounds, and they say, well, why don't we have that available every day? Part of it is just that it's more visible doing that. But as I showed on the statistics, some of the counties that have those kind of sites were actually able to vaccinate a larger percentage of our population than they are currently. So it's something we want to be responsive to the public's requests. But the way we are doing it through our medical partners and through the pharmacies is also getting shots into people's arms just as quickly.
Yeah, I understand that. And I think that's a strong plan. But so I could not go to the county today and get a shot. Is that correct? I could
That's
not.
correct.
So most of our people, the county is administering shots mostly to 1A right now?
These are second doses to 1A that'll be the
Okay.
primary focus the next 2 days.
And those are at the fairgrounds
Correct.
that we're doing these? Okay, thanks.
Sure.
I understand.
Back to that 1B expansion question, Michael. We have the animal control department that reports to us. Are they included in 1B? And if not, is there a way that we can include them to it? Seems like they work with the public a lot.
I know Director Foster, I think you were speaking with the state about that as well.
Yes, I sent in a request for that too, and they said that the animal control falls into public health workers, which is us as well, and it's for 1C. And I asked the specific question because Brett gave me a wonderful example. Thank you, Brett, that I submitted, and I still got the answer that it was considered 1C. So that was very disappointing.
That is. Well, again, maybe that's something we can revisit with them as well. Mr. Shepro.
Yeah, sort of further to Mr. Brown's point, I know that from my work with the fire districts that at least initially, as many as half of them were declining, that even though they were in 1A, they were declining the vaccine. I am assuming, but maybe that's a question for Mr. Isaacson, there is no cutoff date, if you're in that category and you haven't gotten it or applied by a certain date, you can't. But I would think that's also an issue as far as, if it's still open for people to get that, then you're never going to actually exhaust all the 1A people before you move on to other areas. But I guess then the question is, how does the procedure work in terms of availability because we're finding that some of the firefighters are changing their mind, either when they discovered nobody dropped dead or peer pressure or whatever, and they're starting, I think, to come in for it when they initially had not. But is there time limits or supply limits as to that category?
There's not time limits, and we will try to work with the 1A providers. I think on an ongoing basis, that's a conversation that needs to continue of how we protect them. If you remember one chart we used to show a lot that kind of showed the overlapping waves of the tiers, I think we're going to continue to see 1A people step forward. And this includes not only healthcare personnel, but even potentially people who work in long-term care facilities or even residents of long-term care facilities who turn down the shot, that if they change their mind in April, we do want to make sure that we get them protected.
Michael, you can use the example of Amita too, that we're giving them doses this week for their new personnel.
Right. Yeah, absolutely. So that's a good with one of our healthcare providers, making sure that we're providing for them so that they can take care of people. And again, I think another point that's important to reiterate when we look at these priorities is there's two main reasons people are prioritized. One is because they're at increased risk of serious illness or death. And two is because they're at increased risk of transmission based on the work that they do or the place where they reside. So that could be a congregate setting like a shelter, et cetera, or for people who are working on the front lines. And I think that several people have made good cases today for groups like libraries and animal control as frontline personnel, that those are definitely things that we should continue that conversation and make sure we're protecting those people.
Chairman,
Mr. Brown?
as kind of a follow-up to that, the sheriff brought up the other day that the 911 dispatchers are not considered frontline or first responders. Is that correct, Michael?
I believe that we have vaccinated the 911 dispatchers, and I think it's just because, we've worked with the KCOM and the other groups because they are definitely in that first responder tier that are specifically called out in the IDPH guidance as 1B.
So that would be true also of TRICOM for the Tri-Cities?
It should be, yes.
As well?
Yes.
Okay, good. That's good, because I mean, as he talked about the other day, that would be disastrous if it's spread throughout the TRICOM or the KCOM office,
Right.
and who's going to respond?
Right.
Mr. Chair, from Gums.
Gums, go ahead.
Just to elaborate on Mr. Brown's question, there's a differential aspect of first responders. That's just a title through the federal government. That doesn't include their status for the vaccination. So they're not considered first responders on a federal level. They're considered secretarial jobs.
So they wouldn't qualify then under the category of first responders for vaccination?
No, they are considered under 1A just based on their congregate settings. And that's, I think, how they qualified them. But this is a whole completely separate issue that we're trying to get forward to make them first responders.
And I'll just quickly share, because I think this is a nice graphic that the state has, but this is phase 1B, and this is not intended to be exhaustive, but it shows like under first responders, as Ms. Gums just said, fire, law enforcement, 911 workers, security personnel, and school officers. So that's who they specifically named. It doesn't mean that that's who it's limited to. And that's been the gray area that we continue to chip away at here locally And we've had a lot of conversations with our courts and attempts to get in-person courts and our jury trials back operating again, that we've really pushed on the state to try to expand. So I think these are just some examples. And we can make this available to people. I just think it's nice to see the graphic in one place.
Madam Chair.
I certainly welcome this in-depth conversation about the distribution of the vaccines, but it occurred to me, the Health Department does many other things, including that of mental health. And we know that social isolationism, anger, frustration, depression has been all part of this COVID issue, COVID-19 issue. Have we been able to focus as the health department, and I realize that they're short of staff, but as we start transitioning from vaccine to wellness, how are we going to support our families and our seniors to, one, feel confident that they can start going outside, to provide good mental health wellness checks for them, and also for our teenagers who have been stuck inside, and our youth stuck inside trying to go to high school without having their peers or teachers to support them and have those personal relationships. And again, social isolationism. So it's a thought for discussion, because we're going to have to start transitioning to that. So just to bring that point up.
And Madam Chair, I'll just point out, as we look at our community health priorities, separate from COVID, we have identified that the behavioral health, and we use that term to include both mental health and substance use disorders, has been one of our top 3 priorities for a long time here in our community. We do have a couple of formal mechanisms where we're addressing exactly what you're saying, because we completely agree that this is going to take a lot of time for us to heal, really, mentally, and for all the social isolation that we've dealt with. We do have a Kane County Behavioral Health Task Council. We actually are meeting this afternoon at 3 p.m. We meet every other month, but we're meeting monthly here to kind of kick up our plans for 2021. And we do have a large focus on dealing with the impact of COVID on our families. We also have a Kane County Opioid Task Force, which is a more targeted group that's looking specifically at opioid use disorders. And unfortunately, with the isolation and with the stress of job loss, et cetera, we have seen many of our residents return to use. So people who have successfully been able to move past active opioid use, that they're returning to it. So the number of overdoses we have seen are too high. And, that's exacerbated by COVID. But then when you factor in things like an influx of additional fentanyl and different types of drugs that are causing increased fatalities, those are just 2 examples of groups that are actively working. We also have a third children's mental health initiative here at the health department. And we actually just hosted a youth forum a week ago where we brought in teens virtually from the area high schools and had conversations about mental health and how people are coping. So there's a tremendous amount of work that we need to focus on. I absolutely agree with you, but there's a lot going on as well.
May I make one more comment, a suggestion? Perhaps at next month's public health meeting, we can focus some of our conversation on those efforts so that we can share that information with the board, the members of the committee. That'd be, I think it would be most welcomed by everybody. Thank you.
Okay, and I apologize to everyone that is tuning in or waiting for the legislative committee meeting. We're getting through this as quickly as we can. I know people have a lot of questions, though. It's important that we address them and get as much information out there as we can. I think we're pretty much good on that. There is one thing, Mr. Isaacson, maybe you can answer this. It's something I've been seeing come up a lot in the public, and it's the way we prioritize who we're vaccinating. For instance, there was a news article recently that we are vaccinating people in the judiciary and their staff, and I've been getting so many calls. Well, why are lawyers and judges getting a vaccine, but my grandfather isn't? my understanding is that our providers that we send to, the majority of our vaccine goes out to those providers who are servicing the 65 and up population, who are servicing grocery store workers and factory workers, and that it's a small pool, talking about the judges and the state's attorneys and public defenders and the staff, the bailiffs. It's a much smaller pool that is easy for us to accomplish, to take care of very quickly. They're right there next to the jail where the sheriff is already vaccinating detainees and some of his men. And so that is my understanding, is that we're working both ends at the same time, but as far as our direct events, they're smaller and targeted. So is that correct?
Yes, I think that's well said, Chair Sanchez. And I think it's just important, and the residents that I've spoken with, I think, really respect and understand that we don't, and I'm wary of sounding like a broken record, but we don't have enough vaccine right now. So if we have 300,000 people who we need to get vaccine to, when we administer vaccine in the courts, that may mean that the seniors or the teachers or the factory workers are saying, hey, why not me? When we go in and administer vaccine in a factory, it may mean that those other groups are saying, hey, why not me? We completely understand that, and that's why we're trying to get it out in as many places as we can to work, as you said, not just from both ends, I guess, but from all ends, so that we're meeting people, meeting people's needs as quickly as we can.
All right, thank you very much for that. Seeing no more questions under the update, we do have a resolution. Before that, Dr. Silva, did you have a question still?
I do. Thank you so much. I do have a couple of comments, and I will move briefly or fast through this. I'm going to ask a couple of difficult questions that we may or may not have time for answers today. But recognizing that none of us has all the answers and that this is uncharted territories, my only goal is to identify gaps and to find solutions without making anyone feel that their contribution is anything less than valuable. I want to make sure that other board members are aware of what's going on and are empowered to answer any constituent questions, because I have found it difficult to answer these questions myself, and I feel that I have a direct line to public health. One of the concerns that I have is our Facebook page, and I realize we are dealing with we did hire a company to work for some of these things, to answer some of these questions, but some of the concerns that I have are coming from constituents that are asking a lot of questions and sound very frustrating. They sound very frustrated. One of them says, King County must hate us seniors. King County has a lousy web page. So these are things that I point out because I think it's important that we find answers to these questions so that we can fix the problem in order to help people find more answers. So my initial question is, who manages our Facebook page?
I believe that's our communications person.
Okay, so
communications person.
Yeah, the health department Facebook page is what she's referring to.
Is that, can you confirm that so we know which one, because we have the two?
Yeah, that's what she's talking about, the
The-
health department one.
It's the Public Health Department's webpage. Is that what you're talking about on Facebook page?
yes, Madam Chair.
Okay, thank you.
Yes, so these, I have more just for the interest of time. I'm not reading everything, but people sound very frustrated. So the fact that there isn't someone that is responding to some of these comments, I think is making us, is doing more harm than good, because it's creating more confusion as people are responding to each other. So my suggestion, if we can't move the tag company in sooner, is to disable the comments, because again, it's creating more confusion, and or have somebody actually respond to some of these questions. There's a number of them. I don't have an active Facebook page myself, but I went in and in a matter of 30 seconds, I found 5-10 comments that I thought were not good. So moving on to my next question is, do we have a vaccination schedule? do we have access to a schedule of who is going to get vaccines at what times? And is this shared with the people who are actually giving the vaccinations?
Michael or Kathy, can you answer that for Dr. Silva?
Can you restate that, Dr. Silva? I want to make sure I understand. So
So-
a schedule in terms of when future clinics will be is,
Do we have a vaccine schedule? So Mr. A, Y, and Z are on the schedule for receiving their vaccine today. Do we know what time Mrs. A is coming in and what time Mr. Z is coming in?
we do, yes. Yeah, we use
Okay,
the
and-
statewide scheduling system. So everybody has an appointment.
Okay, and is this shared with the individuals that are running the clinic, our first line of contact for the vaccines?
Yes, it's my understanding that it is.
Okay.
I don't work directly at the clinic, but that's what they use when people come in to admit them. They actually have a ticket that they either
Okay.
have a paper ticket or scan it.
Yeah, it's like a concert. They literally are, the appointments are called tickets on the site. So you go there with something either on your phone or a piece of paper, they scan it. Once it's scanned, it's out of the system. So if somebody tried to copy your ticket and bring it in, they'd probably call them a scalper, I guess, at that point.
Okay.
But you wouldn't be
Um,
allowed. So it's very secure in that way.
Okay, so I actually had a meeting with our first line of contact who are working some of these clinics, and they have some concerns. So one of the things that they have concerns about is that they're not always made aware of the schedules, so they don't really know when, how many people they have between 9 and 10. And I'm just looking for the breakdowns of communication. Maybe some people have it, but others don't. And one of their big concerns is the fact that they feel like there isn't enough information conveyed to them. So they would like to have more meeting time, face-to-face time with some of the directors, because I feel that they also don't understand what the process is. I think that's the big breakdown of communication. We as board members don't understand the process. And from what I'm hearing, they don't understand the process either. So meetings, maybe once or twice a week regarding these specific clinics would be very helpful to them. And we can talk about this offline, but I did want to point out some of these things so that everybody is aware and it is a transparent process. Also, I do understand that some of our seniors, and this is my major concern, is that some of our seniors are showing up to the health department because, again, they don't have access to the internet or they're not computer savvy. So when a senior shows up to the receptionist at the health department and they tell us we're not able to use a computer, we need an appointment. What is the process for that individual?
Well, thank you for bringing these things up, Dr. Silva, because I think these are some important things we can address. In the next couple of days, I think we will be able to improve our process when people show up, because we'll have the formal list of where people can call to get the assistance to help them to sign up. One struggle, and again, I don't mean this as an excuse, but even as we work with our partners who are willing to volunteer to help people navigate the system, if there's no appointments, even the tech savvy young person, as Mr. Shepro mentioned, they can't create an appointment if there's not an appointment to be had. So until we get vaccine, this is going to be frustrating for people, even if we're giving them options. But the simple solution to what you just stated is we can make sure that the people at the front desk have a script where we can clearly meet people's needs and that we can create a feedback loop to make sure that they're actually able to get what they need.
Excellent, Mr. Isaacson. That is exactly my goal. I think that we need proper training for the individuals that are our first line of contact when our folks show up. That will help to disseminate some of the frustration, and also perhaps even making a supervisor available to come down, or myself. Please feel free to give someone my cell phone number, because as I told some of the people that I spoke with, they don't need to get yelled at. If anyone needs to get yelled at, no one should get yelled at. But I would rather talk to people and let them know where we're at than having our staff dealing with such frustration. So please feel free to give them my cell phone number. So I think another important thing would be to, again, have these question and answer sessions with management so that flow charts can be shown, and we can go back to the basics. And if we could even open that up to the board members, or at least I would be very interested in hearing what happens from the moment that we get the vaccine to the moment that it gets into someone's arm. Who is actually deciding? I understand that we're getting a number of vaccines and we have a waiting list, but what individual at the health department decides who on the waiting list gets the vaccine, and what are the parameters that are used in order to decide who is going to get it? All of that needs to be a little bit more transparent to people, because right now we're all full of questions. But if we really take a look at our flow chart and we go back to our policies, maybe we need to rewrite some policies. Maybe we need to have things in writing as to what to do when something happens or when somebody has a question. Let's have a clear organizational chart of what happens, again, from the moment that we get the vaccine to the moment that people are vaccinated. The last question, and I'll leave it at this, there's actually a lot more, but I know that we're short on time. The other question that I have is specific training, regardless of their experience, for people who are volunteering to give the vaccinations. Does everyone undergo a training session to vaccinate?
Yeah, we do provide just-in-time training for anyone who shows up at our clinics. Yes.
Okay, great. So I would like to know a little more about this training, and maybe even observe a training to see what exactly is being talked about and what exactly is being shown, because I want to ensure that both staff and the constituency has complete confidence in the way things are done. And again, I haven't heard that things are not done well. I just want to ensure of that going forward. So I would like to take this conversation offline and talk a little bit more about some of these other important things that I've mentioned. But just on a side note, I'd like to know, do we have an anti-racism statement on our website? Anything that denounces racial disparity?
We have had health equity as one of our strategic priorities for a while, and the statements that I think are becoming more popular right now, we do have a policy, but we don't have what would match what is more in line with the statements that more and more organizations are putting forward. So certainly we follow all federal guidelines, et cetera. We have policies specific to health equity. We do regular assessments to make sure that the way we conduct business, using something called the class assessment, where we look at things to make sure that we're doing them as appropriately as possible. But I think that the specific statement that you're referencing, I think that's something that we haven't developed yet, but that would be a good idea.
Okay, just a thought, and I'm wondering. I think you're right. I think it would go a long way to have that on our website. And then just to point out that it is Black History Month, and it would be great to have something on our website, maybe for the future, to just honor the contributions of Black Americans to public health. I think would also be very important. And so also Asian Americans, Latinx Americans, women moving forward, seniors moving forward, that we identify each group. So we can also continue to remind ourselves of the populations that we're working with and working for. Thank you.
Thank you, Dr. Silva. All right, we need to move on. I'll try and get through this as quickly as we can. If you have any more questions or concerns, just send them to me. I'll forward it and get you the answers. And so, yeah, let's move on. We have a resolution. This is a really good one, authorizing acceptance of fiscal year 2021 Illinois Department of Public Health COVID-19 mass vaccination grant agreement. Can I get a motion, Mr. Tepe, and a second? Second from anyone, Mr. Weber. All right, let's open this up for discussion. Michael, are you or Kathy gonna tell us what this is real quick? I can summarize this. Kathy's still on. I know she might have had another thing.
No, I'm sorry. So this is from the state, and this will allow us for money moving forward for vaccination, specifically for vaccinations.
So this is huge as far as developing a mass vaccination site that everyone wants. They have them in Lake County, McHenry County, but right now they're very empty. They don't have a lot of vaccine supply up there. So they do have these sites, and right now we're using the Kane County Fairgrounds, which has been really great for our events so far. But it's not ideal going forward, especially if we're talking about the 65 and older crowd. Being at the fairgrounds last week, with all the snow and the way the parking lots are, it's a nightmare just imagining having all these older people come in and to that site. So this is going to go a long way into helping us establish that permanent site where we can start. As the vaccine rolls in, we can just direct it all to this site. Not all of it, but we'll direct a lot to this site. And then it'll be the thing that everyone wants. Just one place to go, you sign up and you get your shot. I know we are scouting sites. Looking at South Elgin is sort of a good central location to the county. So waiting on some reports from OEM and some health department staff on that going forward. But this grant is going to be the thing that really makes it happen. Any questions or comments on this, Mr. Shepro?
Yes, for a question for staff, does this grant agreement actually exist at this point? Is there actually a written agreement that this resolution approves, or is that yet to be developed?
Kathy, do you have the answer? My understanding is there is a grant. there, and this
Yes,
is just
it already exists, and this is a non-competitive grant. So in other words, you know, the other counties are getting it too. But this will help support our operations hugely.
Okay, I'm making a different point. I've been arguing this for 12 years and I never get anywhere, but this board has made a habit, despite their former attorney complaining about it, is to approve grants or agreements. And it just happens that this came up now. It's not the health department in particular, is that they pass resolutions approving agreement, but no board members actually seen the agreement. And then sometimes it doesn't exist at all and is yet to be written. And I will vote for this today, but I'm hoping that by the time this reaches the county board, maybe we could get the state's attorney to weigh in on whether it's appropriate to approve agreements when the board hasn't seen the underlying document.
Yeah, I think we can get that document
Yeah.
supplied to everyone as well. But point well taken, so
But I did hear this morning, by the way, apropos of the comment on my way here, that the city of Woodstock just donated a huge facility to McHenry County for this type of, and they said the only thing they need is vaccine.
Yep, a lot of vehicles and no gasoline.
Yes.
So, any other questions or comments?
Mavis Bates, please.
Ms. Bates?
This says the numbers are wrong. There's a typo here. $1,225,000 parentheses, $1,250,000.
Oh, you're right. I see that Scrivener's error there. We'll have that corrected.
Okay.
25,000 here, 25,000 there.
Yeah, pretty soon you're talking real money, but not
Yeah,
yet.
we need every single dollar. Yeah, we'll have that corrected. Thank you for catching that, Ms. Bates.
So we Southern people here in Aurora, I would like to say, I have a question. Is this going to be for more than one location or just one? And if so, as member Molina just said, South Elgin doesn't seem very central if you live in Aurora. Excuse me.
Well, I think if you're looking
Center
at
of the universe.
Hold on. If you're looking at the county, South Elgin is kind of a midpoint. So that's
Is it really?
kind of the thinking.
Okay.
But again, we're scouting multiple sites in multiple locations.
Can we
last
have
night.
multiple sites?
If
Could
we
we,
can,
could
we
we
will.
use the health department in Aurora possibly?
Yeah, yeah. If we can establish multiple mass vaccinations.
This is just a
we will.
grant agreement.
Yeah, this is just going to give us the funds to be able to make those decisions based upon the information we get from our site scout. So
Okay.
I would love to have 3, northern, central, and southern. If we can make that happen, we definitely will. So we'll have more information by next month's meeting.
Okay.
Any other questions or comments on this resolution? Okay, hearing and seeing none, clerk, could you please call the roll?
Lewis. Shepro,
Yes.
Strathman. Pepe,
Strathman, yes.
thank you.
Tepe, yes.
Weber,
Yes.
Silva,
Yes.
Lewis is a yes.
thank you.
Thank
All
you.
right. Thank you very much. Next resolution, authorizing health department purchase of mosquito larvicides. This is a pretty standard thing we do every year. Can I get a motion, Mr. Weber, and a second? Mr. Shepro, any questions or comments on this? Mr. Tepe?
Yes, I haven't been bothered with mosquitoes for months. Why are we doing this? That was just a joke.
Oh, okay. Yeah. I was like, well, it's just standard. We do it every year. It's cheaper right now, I think. But they're coming. Watch out. All right. Seeing
It
no other
must be
questions.
working.
No other
Bates,
questions or
please.
comments? Oh, Ms. Bates, go ahead.
What kind of herbicide are we using? Have we gotten the least damaging to the environment?
I don't know. Is anyone online that knows this? Michael or Uche or?
I can speak to that. We take into consideration the one that's least damaging to the environment. This is the same larvicide that we've used over the years from Clark Company in St. Charles.
Okay, thank you for that.
And it's grant funded. We have all the funds to pay for it.
All right, no more questions or comments? Clerk,
Thank
could you
you.
please call the roll?
Lewis,
Lewis, yes.
Shepro,
Yes.
Strathman,
Strathman, yes.
Pepe,
Tepe, yes.
Weber,
Yes.
Silva,
Silva, yes.
All right, moving on, old business. We don't have anything that I'm aware of in old business. Can I have a motion and a second to place the reports on file? Mr. Weber moves. Mr. Shepherd
Strathman,
seconds.
second.
We'll give it to Strathman. All those in, oh, sorry. Reverted to the old days. Clerk, could you please call the roll?
Lewis,
Lewis, yes.
Shepro,
Yes.
Strathman,
Yes.
Pepe,
Yes.
Weber,
Yes.
Silva,
Yes.
Okay, thank you for that. Moving on to, we don't have a need for executive session. For new business, we do have one item. Am I able to share screen right now? Is it set for that? Should be able to. Okay. So, oh, there we go. I emailed everyone this morning. I just received the document last night, so I wasn't able to get it to everyone sooner. But this is just a discussion piece for today that is going to go into a resolution for the Finance Committee next week. So what we're looking at, oh, sorry, wrong thing. That's the wrong one. My apologies. I had the old one pulled up. So what we're looking at here is a request for retaining and increasing some of our staff help for the contact tracing program, as well as our call center, the COVID-19 call center, and then also the temp help that we have in the office. So here we go. You can see the whole thing. So what's going to be going forward to finance, you can see down at the bottom, the yellow bar called current request. So that current request of $864,000 is what we are going to be asking for. And if you remember in December, with the CARES Act money, we had the December 30th deadline. The Public Health Department ended up having to give back just over $1 million because they couldn't perform the contractual services in time. So we didn't want to give the money back, but we were under that deadline. So now here we are, and we need some of that money back in some way, shape, or form. The state was going to help us with contact tracing through, I believe it was March or May. They were going to help pay for the remainder of our contact tracing budget. There were some changes that occurred, and they are only paying for about half of it. So this plan right here, it gets us to keeping the contact tracing staff that we have, adding a little bit more to help with the backlog. We're going to add a few people for various things that are helping out with our entire operation of vaccine rollout. So you can see under temp contract staff, vaccination clinic support. Those are people on the ground that are doing these clinics that need some help organizing, like our volunteers and things like that. Outbreak investigation liaison, school coordinators, outbreak investigation management, resource coordinator. These are all very important functions to the operations we have ongoing. And with the money dwindling, we've already had to let people go. And that's very difficult because we're swamped as it is. I know some people have questions about the contact tracing program, and I'll have more information sent out to you about that, but it is required. It's a law. We have to do this under the state public health department authority. We have to do contact tracing programs, and there's certain numbers we have to be hitting as far as staff. So with the money running out, staff is going lower. We need to recoup that. And the plan is, I believe we're going to work with the savings that we had from the CARES Act, the savings in our budget. We were reimbursed a lot of money. We're not trying to just dip into that willy-nilly. This is a very well thought out plan proposition. The overall needs we will have going through November, you can see at the bottom, future requests, 2.3 million. So instead of coming to you with that entire amount right now, we're just asking for enough to get us through the end of May. And in that time, we're hoping that the next round of CARES Act money that's being discussed in Washington, D.C. will be released. And once that happens, then we'll be able to take CARES Act money to use for whatever health department operations we have ongoing related to COVID. So essentially, on Wednesday at Finance Department, we can discuss more of the details of this proposal, but it's going to be that $864,000 price tag, and the caveat that if the CARES Act money doesn't come through by May, we may have to come back for some more, and that would be the total amount to get us through till November. So if there are any questions on this, I emailed this to you all this morning, and I'll make sure the entire board has it going forward. Mr. Tepe.
Yes, sir, Mr. Chair. Are you saying that there's going to be a resolution prepared that's going to be presented to the Finance Committee for this 864,000?
Yeah, sorry if I wasn't clear on that. Well, a resolution will be on the agenda.
So that resolution be prepared, so it won't be vetted by us except for this, correct?
Yes, but it will be vetted by the Finance and
Yeah,
Budget
just
Committee,
asking.
the Executive Committee, and the full board. So at least 3 public hearings on the matter. We weren't able to get it together. There's a lot of holes in the ship and fires happening that we have to put out and deal with. This is something that we've been working on past couple of weeks, trying to crunch the numbers. We only wanted to do this one time. We don't want to keep coming back for money. And that's why I said, let's just go to the end of May and then see if that CARES Act money comes in so that we don't actually have to come back to the board for anything else. Mr. Shepro.
So how much, if any, of this is currently funded through unallocated CARES Act, or is none of it?
The CARES Act money has been spent.
Right. So,
Mhm.
so this is not from some, like I know there were some funds that were put back in because I think, for example, the sheriff's radios were ruled to not be eligible.
Mhm. So that's the savings from the CARES Act.
Right.
fund.
But all of this is new money or money that we hope will be forthcoming at this point?
In this proposal?
Yes.
New money is, I don't know what you mean by that.
Well, in other words, if it's funded, it would be funded by whatever Washington might send down the road. I guess that's my
Be
question.
Reimbursed, would it be reimbursed? If we get more CARES Act money, would we be able to come back and
Right.
say, oh,
At this point, this
proposal-
is money that is coming out over and above our budget or any CARES Act funds because there aren't any more CARES Act funds and it's
There are,
not
yeah, we
budgeted.
had to give back $1 million from CARES Act.
Right.
But because of the CARES Act, we have a lot of savings from our budget because of all the payroll that we were able to get reimbursed. So that's a whole bunch of money that was in our budget for those purposes that now we have just.
Right.
in a
I guess
separate
I'm just
fund.
trying to get a handle on what this does to our budget if there's no additional funding that comes from Washington.
If there's no additional funds that come from Washington, we'll be in a bit of a pickle, I
Okay.
would like to think.
Yeah, okay.
Because again, my understanding is we'll be dipping into the savings. I don't know that we'll want to use the contingency fund, so we have to connect with Onzik a little more deeply on it. He's already been consulted on some of this, so again, the savings from the CARES Act is most likely where we would want to take this because originally we would have had this money already. That $1.2 million, I think that we gave back
Right.
would have covered this already. We wouldn't be having this conversation. So, and hopefully we would be reimbursed for this as well. So we wouldn't even need to use that savings.
And this is, I guess, another unfunded state mandate.
Yeah.
Thank you for that.
Mr. Weber.
Thank you, Chairman Sanchez. I remember when we originally did the contact tracing agreement, it was a third-party company that was doing the contact tracing.
Mhm.
So is this looking to extend that with that same company, or are these
We're using
all-
the same company. Yeah.
When I look at some of these numbers based on the people that are testing positive and the number of contact tracers that are making phone calls, it seems it's not very, the numbers don't look good as far as what we're getting for the spend. I would love to see some good data analytics to show how many calls these people are making a day, how many people are communicating. Like, before I would be comfortable putting more money into this. I mean, if I took the numbers from basically the other day of positive cases, you have 55 people making, each person they're basically making a half a call per hour, not even a full call per hour. So I just would love to see some true analytics to show that.
Yeah, so I'll have that for you. Well, I'll see what we can put together for next week ahead of this resolution at Finance. I was just talking with Uche yesterday and actually going through some of the information that we get from KPMG, and we're going to start getting kind of a weekly update from that program so we can increase the transparency, because we are getting data. It's unruly. What we get is very unruly. It's not easy to just pass that out.
Because I think we had $13 million into that program.
No, that was the total health department request.
Was
that
it
13
8
million.
then?
I believe it was 5 million that we spent, or 5.6 that we spent on the contact tracing
Okay.
program. And again, it's something that we have to do. And that's, I'll make sure you guys get those documents as well, like the statute that tells us we have to do this. Otherwise, we wouldn't.
Well, sure, we have to do it.
necessarily-
Yeah, but I just want to make sure that there's not 55. I mean,
Yeah.
they're
We want to get
I
our
want to be
money's worth.
responsible with
Uh-huh.
the money. That's all.
Yes, absolutely. So yeah, we're working on putting together that information to increase this transparency.
Thank you, Chairman.
Mr. Shepro?
When they say we have to do it, they don't necessarily tell us how we have to do it though, right? I mean,
As far as contact tracing goes,
yeah.
I don't know the level of.
I
control the
just,
state
my
has.
son, the data scientist, always tells me that data is good, but it should be actionable data that you can understand and use in some useful fashion. Otherwise, you're just
Yeah.
spinning your wheels.
So I don't know the answer to that question, but I know that our team is working really well. So we'll get more of that information to everyone going forward. Any other questions or comments on this discussion item?
Mr. Chair,
Mr. Brown?
just to follow up on what was just said, spinning wheels. What's ironic about this whole thing is if we could just get more vaccine, maybe we wouldn't have to do contact tracing.
Well, let's get some more vaccine and talk to the state legislators. Madam Chair.
Just to respond to that, perhaps we could use some of that money and buy directly from Pfizer or Moderna. Just a suggestion.
We get a better deal, that'd be great. All right, any other questions or comments on this item? All right, so look forward to that at the Finance Committee, Finance and Budget Committee next week. I already spoke with Committee Chair Berman to get this put on. So we'll have at least the title placeholder on there, and once a resolution is put together, and then I'll get you as much information as I can leading up to that meeting next week. So, all right, thank you, everyone. I wanted to indulge everyone's questions and comments. There's just so much anxiety around this issue, and the more we can talk about and discuss openly, the better. Again, we've been working on increasing our transparency. We have the marketing team we just hired on. We had our first big team meeting on Monday. So I think they're going to be a real help. I didn't realize he was going to have 7 people working on the case. I honestly thought it was a much smaller team that he had. So that I think they're going to do really well, and it's going to take a couple weeks until they can really get the wheels turning. But you're going to see a big difference in our output. And again, I'm trying to increase the transparency also through this committee. So if there is any information that you want to see that you're not getting, anything you want to report on, let me know, and we'll make it happen. So, all right, if there's nothing
Motion
else.
to adjourn?
I was just going to say, well, we do have public comments on non-agenda items. I do not think we have anyone here to make those comments. So Mr. Shepro moves to adjourn. Mr. Weber seconds. All those in favor?
Aye.
Aye. Aye.
We are adjourned.